mental health. It's someone's emotional, psychological, and social well-being. For many parents, the question becomes, when is it appropriate to discuss mental health with a child? Well, new research reveals parents are divided on that issue.
NBC4's Sierra Johnson joins us now, taking a closer look at this very interesting issue and walking us through some of the barriers that exist that may prevent that conversation from even happening.
That's exactly right. Really complicated. Excuse me. Parents have so much to tackle in today's world, and mental health, it's a big one. But navigating that conversation and knowing when to broach the topic, it can be tricky.
When you have an older kid, that older kid has the opportunity to continue to be a kid.
With more than 125 episodes of the cleverly named Dadass podcast, father of two Matt Lofi and licensed professional counselor Sean Diddy tackle all things parenting, adulting, and mental health.
People are looking for entertainment, but also some substance.
And it's that intersection of mental health and navigating the often complex and intimidating topic with children that has become truly educational for the pair.
We had no idea. I don't think my wife and I ever had a discussion about mental health, and it really was because of the conversations we're having.
These conversations approach a topic that new research says has parents divided. The Kids Mental Health Foundation released a study that reveals 75% of parents with school-age children agree that mental health conversation should occur before middle school. But less than a quarter think they should be talking to their children about mental health before kindergarten. Experts say while there is no set age to broach the topic, the earlier the better.
Kids are feeling and thinking and acting as soon as they come out of the womb, right? And we want them to be able to understand how they feel. We want them to be able to cope with those strong emotions and be able to figure out, like, what's the best decision.
This doctor suggests discussing feelings openly and freely as you would like teaching letters or numbers.
In general, when we talk about just mental wellness and being mentally healthy, that's not something I think that most people are thinking about, and how we can help our kids. Those are things that I think we still need to work on.
She also suggests taking any range of emotion as a moment to listen and share that feelings are okay. The advice these podcasters are hoping to convey to their listeners as parents navigate in unknown territory.
A lot of what we exemplify as parents and partners gets taught to our kids.
Yeah, the Kids Mental Health Foundation is based at Nationwide Children's Hospital, and they offer tips for parents, coaches, and caregivers on how to talk about mental health with your children in your life. So a lot to digest there, but just the earlier the better is really the big takeaway.
Yeah, and I think we've seen those conversations kind of evolve. We talked about how when we were growing up, there wasn't really that discussion about mental health or those resources really available. So seeing all of that being implemented now, hopefully those kids can take that with them as they become adults.
Yeah. Thanks, Sierra. Well done.
Thank you.
And remember, if you or someone you know is struggling, you are not alone, and you do not need to suffer in silence. Help's available. The number for the National Suicide Prevention Lifeline is just 3 digits, 988. Help's also available with the Ohio Suicide Prevention Foundation. Just dial 614-429-1528.